everyone. I am Kaylee Marston, a speech-language pathologist here at Levine Cancer Institute in the Department of Supportive Oncology. And I am part of the cancer rehabilitation team here. That includes physical therapists, occupational therapists, exercise specialists, and physiatry. And I wanted to talk to you guys a little bit about how to refer to our services. And before I do that, I'm just briefly going to touch on what are some of the services we offer. So we see patients undergoing cancer treatments or really anywhere in their cancer journey or survivorship. And we treat those who have physical impairments such as difficulty walking or other mobility issues, cancer-related pain or fatigue, fine motor, gross motor skills or impairments, lymphedema, pelvic floor therapy, cognitive therapy, swallowing disorders, speech and language. So we cover a lot here, and if you think that any of these services are something that you need, we really encourage that you speak to one of your Levine Cancer Institute providers. That can include medical oncology, radiation oncology, even an integrative medicine doctor, and they will be able to put in a referral to our department, and our scheduler will reach out to talk to you about scheduling an appointment. So again, if you have any interest in pursuing these services, please do not hesitate to talk to your providers and they will be able to put in a referral. Thanks.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.